you so much. My name is Zilire Luka. I'm from Malawi. We were also. This is not my presentation,
Yeah,
so don't confuse people. So we were also involved in the COVID collectives, but our assignment was limited to the COVID rollout processes in Malawi, more especially focusing on informal settlements. As usual, we are from SDI. In terms of the background, we worked with the 75 community leaders, and these leaders are coming from 5 informal settlements in the city. Mainly, our methodology, we used a questionnaire. So we used one methodology. We collected this information using a structured questionnaire. It was a one-on-one discussion. Some background, we as a country, Malawi, we have set a target to try and vaccinate 60% of the 19 million people by December 2023. Suffice to say that at the time when this research was being conducted, we had only vaccinated 2.5% of the population. That was then. Now we have made tremendous progress because we have vaccinated 5.8% of the population, and that's progress. That's around 2.5 million people, mainly in the urban centers. Our assignment focused on 3 key issues. We were looking at accessibility and availability of vaccines in the country, more especially in informal settlements. We also looked at the issue of uptake, people's interest to get vaccinated. And finally, we looked at the hesitancy and factors behind the hesitancy. So, in terms of availability, at the time when this research was being conducted, vaccines were not readily available. It was a struggle to access vaccines. And it was a big struggle for people living in informal settlements to get vaccinated because they had to travel long distances. There wasn't deliberate effort to try and situate vaccination centers close to informal settlements. But that is likely a situation in most countries, because back then when the vaccines have just been rolled out, it was a challenge to access vaccines, even for countries. So it wasn't about necessarily about informal settlements. But I think the government's decision not to consider having vaccination centers close or within informal settlements is what we saw as a problem. In terms of uptake, what our research showed was there was that mismatch. There were more women getting vaccinated than men. The reasons we were getting were women used to being injected. That's what they were saying. During pregnancy, they take kids to the hospital. So maybe men were afraid to be vaccinated because of those reasons. The issue of hesitancy, honestly, people were skeptical. Even today, more people are still skeptical because as we are talking now, vaccines are available in the country. But people are not getting vaccinated. We are one of the countries that destroyed jobs because they expired. We faced a backlash from development partners as to why we are destroying vaccines. why people are skeptical? There are all sorts of misinformation, more especially online, religious reasons, and what have you. We found it interesting because as a country, we have just detected a polio case. It was an imported one, and the government, the WHO, have set up a vaccination program for children up to 5 years old, and right now it's being rated as one of the best programs because we have already vaccinated more than 75% of the kids that are under 5 years old. But that process has taken just 3 years. Now, if you compare that with the COVID vaccines, there's a stark difference. People are happy to take their kids to the hospitals and have them vaccinated, but they don't want themselves to go and get vaccinated. There are a number of reasons to that situation. But right now, because the research was carried out some time back, right now the situation has changed a bit. What we see is the COVID vaccines are now available, but the uptake is still a problem. As I said, from the time we did the research to now, we have added another 2.5 of the population being vaccinated. From the newspapers that I saw yesterday, we have around 1.3 million jabs in the country that are waiting for people to get jabbed. We have also seen an interesting thing after the research was done. So what happened during the peak, I don't know whether it is a peak, but at that time, when COVID was the real deal, now it's Russia and Ukraine. There is no longer an issue of COVID. So when COVID was an issue, government established I would say structures to handle issues of COVID. So those structures were established at the central level, led by the Vice President. The city governments were also instructed to set up similar structures, but there wasn't a deliberate effort or a directive to have similar structures at community level. Right now, government has also set up structures at community level, and those structures are being trained. The structures are being used in various ways, but one of them is they're acting as a vehicle for information. So when communities are looking for information, they can find a chief or any other community leader to get the right information or to try and understand the issues that are affecting them in the community. Basically, those are the things that I would say our research found out. But just to say that as in any other settlement, the impact is now coming out and is so devastating. What we see is COVID has exposed those fault lines, the fault lines that we mention on a daily basis. And it is important, my colleague Georgie explained a lot of policy position or directions that we have to take. And it is important that those suggestions should be looked into. Thank you so much.